Hello and welcome to the National Alliance to End Sexual Violence webinar honoring Sexual Assault Awareness Month by advocating for survivor services and prevention. My name is Maureen Gallagher and I'm the Policy and Programs Manager at the Alliance. I would like to thank you all for being here today. We are so excited at the level of interest and participation, folks wanting to learn about the federal policy and funding priorities to support survivors and prevention of sexual violence, as well as how you can participate in advocacy for these important priorities. On the next slide, you'll see that the team of NASV, all of us here are on the call today. You will be hearing from some of us, and then others of us are doing work in the background. So I also want to let folks know that we are happy to take questions. We'll be utilizing the Q&A for that purpose. If you have questions, please drop them in the Q&A box. If possible, we can perhaps answer them in the Q&A, or we will have some time for Q&A at the end of the webinar. So please do utilize that. Um, okay, before we go any further, I'm so honored to introduce you to Monica Johnson Hostler. She is the president and CEO of the Alliance. Monica is a prominent, respected, and effective leader in the movement to end sexual violence, and she has been for many years. I won't say how many, I won't out her. She holds many roles, including as the executive director of the North Carolina Coalition Against Sexual Assault, and is also an elected member of the North Carolina House of Representatives. She inspires me daily, and I'm sure she will inspire you. And I will turn it over to Monica for some welcoming remarks.
Thank you for your kind words, Maureen, and thank you all for joining us this afternoon as we honor, recognize, and reflect on Sexual Assault Awareness Month. For those of you who may be newer to our community, the National Alliance to End Sexual Violence, or NAESV, is a national voice for state and territorial sexual assault coalitions. NAESV works to advance public policy, support coalition leadership, and ensure that survivors across the country have access to services, protections, and prevention efforts they deserve. At our core, we are a collective grounded in advocacy and driven by survivors and committed to ending sexual violence in all of its forms. Right now, many of us, maybe even all of us, are gathering in a moment in a month that we prioritize that may feel uncertain, heavy, and maybe even chaotic because there is a lot of chaos and uncertainty right now around us and affecting our movement. Many of you are stretched thin, both personally and professionally. We know that you're worried about survivors and your local programs. For our leaders, you're worried about our staff, our funding, your families, and also your communities at large, but also about each other and who we are to each other in this movement at this time. We share those concerns with you. Sexual violence is in the headlines daily. We're barraged with stories that bring long overdue truth to light, stories that reflect bravery of survivors, but also stories that can be deeply triggering, exhausting, and even overwhelming. The work is never easy, and moments like this feels hard. There is also uncertainty in our systems that we rely on, questions about stability, about resources, about what comes next. And through it all, we know so much is being asked of you, and you're carrying a lot. So, first, let me say thank you. We appreciate you, and we see you. Thank you for showing up. Thank you for continuing to center survivors. Thank you for your leadership, your compassion, your persistence, even when it's hard. We hope and truly hope that you are finding moments to rest along the way because your well being matters too. Your well being is what keeps this movement alive. At the same time, we know something else has to be true. Often, there are two things true at the same time. When things feel uncertain and we might feel stuck or even hopeless, coming together matters. Our connection matters, and the action that we take collectively matters. That's why we want to bring our community together in April during this chaotic, uncertain time during Sexual Assault Awareness Month, not just to reflect, but to reconnect, share our purpose and our collective power as we hear stories that we've heard from many of you, the data that we appreciate that many of you contributed to. Together, we have created real change for survivors, for systems, and for communities. And together, we'll continue to do that by empowering ourselves with knowledge, resources, and support, by speaking truth to power, showing up as people who can be counted on, even when the outcomes that we hope for, strive for on behalf of our survivors aren't coming to fruition. We are still standing strong together. So, whether you're testifying before your local government about your program's needs, advocating for survivors' rights at your state legislature, navigating conversations with grant managers about delays, about solicitations, or urging members of Congress to invest in prevention, we hope today remind you that your voice matters, your voice counts, and you are not alone in this work. Just now today, you're with 200 of your colleagues. And so we are standing together and will continue to be here for each other. Thank you.
Great. Thank you so much, Monica. It is just amazing to have so many advocates and folks together today on this call. Um, just a quick run through the agenda. We will be talking about the data that Monica mentioned from our most recent Rape Crisis Center survey. We'll be talking about some advocacy basics, how to plan and coordinate meetings with your policymakers. We'll have a great panel discussion that Monica will be part of, as well as our other wonderful guests, Amanda Grady Sexton and David Gans, and we'll tell you a little bit more about them in a little bit. And then we'll go through all of the congressional requests and talking points that you need specifically for the federal policy priorities that we'll be talking about today. And then we hope to have some time for Q&A. Next slide, please. So we wanted to start off by talking about our Rape Crisis Center survey. We do this annually. The Alliance has done this for a number of years. It is critically important. And we wanted to start because it is the voices of the folks who are here participating. It's you who are at rape crisis centers who are filling out these surveys and giving us the information that informs our public policy advocacy for the year. So it helps us identify and then share with policymakers where are the gaps, where are the needs, what are the things that survivors need and that organizations need to prevent and address sexual violence. And so each year we issue the survey out to all the US states and territories. We send an email out. Primarily, we go through your state or territory coalition, who sends it out to all of their Rape Crisis Center members in their state and territory. We also reach out through our culturally specific and tribal partners who send that out to other programs who might not be getting it through a coalition. And then we actually do some really intentional targeted follow-up to the states and territories that we haven't heard from yet. And so we made some great efforts to do that as well. So at the end this year, so it was the end of 2025, we did the survey. We ended up with 449 completed surveys. It's representative of 41 states and the District of Columbia. And here's what we found. Next slide, please. So one of the main areas that we asked folks about is what your funding situation has been in the past year, and we found that 46% of the responding programs experienced a decrease in funding for direct services. In the prior year, 50% received a decrease in prevention activities, funding for those activities, and 53% of the programs responding had to decrease their staffing in the last year. Next slide, please. But despite this decrease in funding, there was a significant increase in need that was unmet. 60%, in some cases, unmet. And 60% of programs, despite the lack of funding, experienced an increase in demand for services for sexual assault survivors. 56% increased demand for prevention and education activities. 44% had an increase in demand for adult survivors of child sexual abuse. And 70%, which is the largest number that we had, reported an increase in demand for housing services for survivors of sexual assault. So what does this mean? The impact of less funding, more demand. What you told us, what advocates told us, was that there are 33% of your programs have a waiting list for mental health counseling and or therapy. And of course, that's the organizations that have such resources. 50% report having no such mental health counselors on staff. And so are working with community organizations to try to meet the needs of those survivors. Housing is the number one unmet need of survivors of sexual assault. This is followed by cash assistance, basic needs such as food and clothing, and mental health care. And throughout the survey and the open-ended questions that we asked, we heard over and over again about the lack of capacity to hold support groups, lack of transportation options for survivors and for advocates, and the lack of housing resources, once again, for survivors. And I'll just note on the last couple of slides, we had some quotations up here. I don't want to read them, but they will be on the slides that you'll be sent. Just it's the voices of the folks responding to the survey, telling us about the realities of what's happening in your communities. The other piece of data we wanted to share with you, or data resource we wanted to share with you, is from the National Intimate Partner Sexual Violence Survey. This past year, the Centers for Disease Control issued a sexual violence brief, which was a small report about some of the data from 2023-2024 data collection. I won't read through all of these data points for you. You can see them for yourself, but of course see that the prevalence is still very high. Most of the data you see here identifies prevalence across individual lifespan. There is some data in the brief of respondents' experiences of sexual violence in the past year. Some of that is limited because the numbers are lower. And a real highlight of this study is the state level data that's included in the brief. And I know the link to the study, the brief has been dropped in the chat, and you can check that out, and you'll see tables on that in that document that show you state by state some of these prevalence numbers. I mean, I would caution that because of some changes over time and the way the data is collected, and this caveat is in the report, you can't necessarily compare state to state. You can't necessarily compare this to previous year surveys, but the data is rich. So I hope you'll take a moment to take a look at that. And now I will turn it over to my colleague, Terry Poor, the policy director at the National Alliance to End Sexual Violence.
Hi, everyone. I'm so glad to be with you here today. And as Monique and Maureen shared with you, we are so grateful for all that you do every day on behalf of survivors and your communities. We are truly honored to be with you and inspired by your work and how much you love and care for survivors and your communities. So we're going to talk a little bit about an overview of public policy, lobbying versus education, and kind of get into it a little bit. So what is public policy? Public policy is a system or framework of laws, regulations, and actions that are used by government entities to achieve economic and social goals. Public policy is established at all levels of government. So whether that's at the city level, the school board level, in your town, in your state, and also obviously at the federal government level. There are many levels where we can influence public policy. We often think first and foremost of laws. We try to pass legislation to change the laws, and that's a very important element of public policy. But there are others. As we've been aware lately, there are executive orders, whether that's from a president or a governor or a mayor. There are city and town ordinances. There are rules and regulations that administrative governments will take if there's a new law and they want to lay out ways to implement that law. They may put out a rule or a regulation, and those are things that the public can comment on. Ballot initiatives where citizens can directly vote on public policy issues, court rulings, and very important and central to our work and to the needs of your programs, budgets and funding. So those are all different aspects of public policy. There are different types of advocacy, right? Because there's different types of public policy. So legislative advocacy can involve talking to your city council about a city ordinance you want to see, or your state legislature about a state law you want to see, or Congress about a federal law you want to see, or something that you want to see appropriated, which is just a fancy word for funding. But then we all engage in systems level advocacy every day. So for example, maybe you build a relationship with your local continuum of care COC organization that provides services to homeless people because you know that survivors need access to housing. So you build a relationship with that COC to help survivors. Or you help create a sexual assault response team with law enforcement and prosecutors to make sure survivors are getting accountability when they seek it through the criminal justice system. Or through healthcare, whether that's through establishing a sexual assault nurse examiner program or making sure survivors have access to a broad range of behavioral health care in your community. Those are examples of systems level advocacy that's so important to making sure survivors have what they need. And then there's administrative advocacy. So that's talking directly with agencies of government, whether that's at the state level, the federal level, or at the local level. So for example, we might talk to the U.S. Department of Justice about how we want to see them implement Violence Against Women Act grants. You may talk with your state agency for healthcare about what survivors need. You might also comment on rules. That's part of administrative advocacy. So we want to just encourage you to think about being involved at various levels of advocacy and really support and empower you to feel like you can raise your voice in the public policy dialogue that's happening in your community at whatever level. So a big question that comes up for people whenever they think about advocacy is, I want to be ethical in this. I want to protect my program. I want to do what's right. So help me understand what's the difference between lobbying and education, what I can do and what I can't do. So if you're lobbying, you are making a very specific request to a policymaker to take a position. Usually you're saying, vote yes, vote no, provide $100 million to the sexual assault services program. You're asking for something very specific. If you're asking them to take a position, or you're telling someone in your network, like a program that you work with, you should tell your member of Congress that they should support $100 million for SASP. Those are examples of lobbying. Now, nonprofits can engage in lobbying. Nonprofit organizations and private citizens can engage in lobbying. So we'll talk a little bit about more about that. But we also want to really uplift the idea of educating policymakers. So you can do a lot to interface with policymakers that is not lobbying. So if you want to go and sit down with one of your members of your state legislature and talk to them about your program, talk about the services you provide, talk about what survivors need, talk about the things that you're seeing in your community. And if you want to stop short of saying, and we need you to give us $20 million, that is education. That is really talking about, what you do, what you see as important, and that is perfectly acceptable and not considered lobbying. As I said before, organizations with the 501c3 status can lobby, and it's often appropriate to do so. However, there are annual lobbying limits that must be recognized and follow, and this varies by state. So a little bit more on this topic, because we know that people always have questions about this. You can never use federal, usually any government funds, they cannot be used for lobbying. So you can't use your time that's funded by a grant to lobby. And 501c3s can never engage directly in political campaigns where they support a particular candidate. You cannot do that as a nonprofit. So those are important things to say, like, these are over here. We cannot do those things. But nonprofits can engage in elections in nonpartisan ways. For example, if you have in your town, you have people running to be on your town council, you can have a forum where you invite everybody running and you ask them questions related to how they support survivors, how they approach the criminal justice system, what they think about prevention. As long as you include all the candidates and you ask everybody or tell everybody the same thing, that is also perfectly acceptable. 501c3 organizations can engage in efforts related to ballot measures, supporting ballot measures, and individuals can meet with policymakers and advocate for certain policy positions outside of their work time. So you are a citizen and you can, in your private life, away from work, take time off from work and go make your asks of your policymakers. That's something very, very important to do. You also can, I see some questions coming in the chat. You also can be involved in getting out the vote operation. So as long as that's nonpartisan, so if you're helping, if part of getting out the vote operation is driving people to the polls, things like that, helping with elections, those things are all, as long as they're nonpartisan, are acceptable. I think you could use any expertise you have as a human. You just wouldn't want to talk about your position, answering a question from the Q&A. Okay, we're going to go now to a little interaction. We're going to do a poll. And can you let us know on this poll, have you ever met with a local policymaker to discuss sexual assault services and prevention? Have you ever met with a local, state, or federal elected officials? Actually, the question. So please join in and cast your vote, yes or no. And hopefully you should see the poll and be able to directly participate.
Looks like we have, I'm not sure what people are viewing, but we have about 45%. Yes, they have met with a local, state, or federal elected official, and about 55% have not. So we're little bit not quite half and half, but there's a lot of folks on the call that have experience and some that haven't done that before.
Okay, that's wonderful. That's perfect. So for those of you who have, we'll want to empower you to take whatever your next step is. And for those who haven't, we hope by the end of this webinar that you'll feel comfortable taking a very specific action of some kind or the other, whether it's, educating a policymaker or moving forward with one of the specific asks that we're going to talk about in the second half of this webinar. All right, now it is my pleasure to turn it over to our wonderful policy consultant, Ellen Fern.
Thanks so much, Terry, and good afternoon, everyone. I'm really excited to be here. I love talking about how to be an effective advocate because many people are afraid to meet with their elected officials or nervous and think, oh, well, I'm not an expert. I can't do that. But I want to share with you today that you are the expert on working with sexual assault survivors, providing services, working in prevention, and talking about barriers and challenges. All of our elected officials, are elected to represent us as constituents, our communities, and they all want to make constituent lives in our community safer, better, more effective. But they can't know everything about every topic and challenge facing all of their constituents. And that is what makes our participatory democracy wonderful and strong and purposeful. And so I want you, I hope by the end of this webinar, and you're going to be hearing from experts a little bit on our panel about how important your voices are. And that when you go in and have a meeting and request a meeting with an elected official and or their staff, because elected officials are very busy, so they can't meet all day and every day with everyone who wants to meet with them. And that's why they have skilled professional staff working for them to make sure they're receiving the input and needs and desires and challenges of the constituents they're serving, and then they can relay that up to their elected official. But they are all excited to meet with you because they know you are the expert coming in to tell them about sexual violence and the needs of survivors in your community. Your experience, your stories, your anecdotes illustrate these needs, and also what challenges are facing survivors. Sometimes staff and elected officials they don't want to look like they don't know everything about the topic of sexual violence, but they don't know everything, right? They are not experts in this area. They're not working day to day in the profession as you are. They are not meeting survivors every day. So they need to understand the facts, the figures, the data, both at a national level and at a local and state level. They want to hear real life stories, real life examples of what's working, what is effective, and what isn't effective, and what is needed to help you meet the challenges facing survivors. The other thing is that advocacy is not an ongoing activity, not a one-time activity. It's not one and done, like you've met with someone and now you think that the job is accomplished. It is building an ongoing, strong relationship that is based on reliability, dependability, and that you want to be seen as the go-to resource for staff and elected officials. You want to give accurate information, timely information, and you want to also build the mutual respect. You might not always agree on every issue, every way to meet a goal, but you want to respect each other's time and expertise. I'm going to say this a few times. You really want to build your reputation as a go-to resource for policymakers. So when they see something come across their desk related to sexual violence, related to prevention needs, they know who to pick up the phone and call and just ask your opinion or ask for specific examples of what you are seeing in your program, in your community, in your day-to-day interaction with survivors. Next slide, please. So one of the easiest ways to do advocacy is obviously try to schedule a meeting with policymakers. If they are federally elected officials, representative or a senator, these members of Congress have offices in DC. They love to see and meet people if you are able to come to DC, but of course not everyone can make their way to Washington, DC. But all members of Congress, and of course your local elected officials and state elected officials, have offices in your community. And so when you request a meeting, you are going to want to go to that meeting once it's scheduled with some background information and knowledge about the policymaker. You want to go into the meeting well equipped, and you want to know, well, what committees does the policymaker sit on? What are some of their key priority issues they're working on? What are they most proud of? What are they, where are they going in the community? How are they communicating with constituents? Are they having events where you can go in and meet and greet, or are they going to ribbon cutting ceremonies? You want to know what is happening with your elected official. You also, once you've got that meeting and you have a little bit of background knowledge, you want to really think about who you're going to bring to the meeting. You don't want to bring 20 people to a meeting. That's probably not the most effective, but you want to have key people in your meeting. Maybe a member of your board, maybe, if appropriate, a survivor, other advocates who can speak to the work. And you want to know exactly how you're going to use your time. You want to be prepared with your talking points and think about your meetings probably in 30-minute time slots. As I've noted before, elected officials and staff are very busy. So you want to think ahead of time how you're going to start your meeting. It's always good to start on a positive note and thank the elected official or their staff for the work that they are doing and continue to do, and then go in and tell staff or the elected officials a little bit about program, what you're doing, what you're coming in to ask. And further educate them on. You want to be honest and truthful. And even if you don't think you're going to be seeing eye to eye on a topic, always remain respectful. And think of this, as I said, as an ongoing relationship. So if in the first meeting you don't end the meeting and you think you're seeing eye to eye with the people you're meeting with, you know it's your challenge to keep building and educating them, building that relationship, educating them, sending them information to help educate them as to why maybe more funding is needed or a different kind of services are needed or what barriers are in your way from serving all people coming to your doors. Also, it's always a great idea to follow up and know that you're going to be following up. Always have some information maybe that you can send after your meeting when you send your thank you for their time, that you send a little follow-up information to reiterate what you went over in your meeting. Also, often you might get asked a question during a meeting that you might not know the answer to. Please don't ever, ever make up anything, make up information. It's perfectly fine to say, you know what? That is a really good question. I don't have the information for you now, but I know who to go to get that information, and I will follow up and get you that information as soon as I can. And all of that helps you build an ongoing relationship. It's very frustrating for elected officials, staff, I think especially to for folks to come in, for stakeholders to come in, educate the staff person on an important topic, and then they never see you again. You know, it's a building that ongoing relationship helps that staff person do a better job, keep his or her elected official in the know and understanding about community needs. And so a meeting is just a start of a beautiful relationship. Next slide. There are other ways, obviously, to engage policy makers once you've had your initial meeting, or, you know, they can't meet with you, you know, every 2 weeks, but there are other ways to keep in touch with policymakers and engage them in your work. That might be, especially during Sexual Assault Awareness Month, you might want to invite them for a tour of your organization or to an event that you're having as part of Sexual Assault Awareness Month. You can invite elected officials to maybe an event you're having, a fundraiser, an open forum on topics facing survivors in the community. Most elected officials love coming to listening sessions to hear from their constituents, and really so they can be in a listening and learning mode. And so that can be a two-way conversation between people coming to share their experiences and the elected official maybe responding with some ideas they might have to solve some of these challenges. You can go to your state legislature or city council, listen in on hearings. What are legislators talking about? What are they concerned about? Maybe inviting them to volunteer at your program. And also also, of course, there's social media out there to create awareness about your program, the successes you're having, and some of your challenges, and you can tag policymakers just to keep them in the know without having to see them face to face. Next slide, please. Other ways to engage in policy advocacy is obviously voting. It is very important to vote and to help survivors register to vote. You are not telling them who to vote for or, who to vote for. That would not be acceptable, but you can help them and encourage them to understand how to register to vote and get out and vote. You should be following your local and state news about and following and tracking what issues are of importance. What are members of Congress talking about? What are your state legislators talking about? You can organize community groups where you can come together and share information about local policy updates. So it could be like a social gathering, but sort of like a current events session to share information about what key members in your community are tracking. And so you can find issues where you can work together or mutual issues of uh, that you might not realize another community organization is concerned about. You can collaborate on these issues, and you can also engage with your local newspapers, writing letters to the editor, op-eds of issues of concern. Op-eds are a wonderful way to share your point of view on something to many individuals who might not even know it's a problem. But by writing an op-ed and trying to get it in your local paper, you're educating even more people about an issue you care deeply about. Terry?
Awesome. Thank you so much, Ellen. Really appreciate all that really good concrete information, and know that there's more available in our toolkit, Empower and Educate, advocating for sexual assault services and prevention. You'll see that you can link to that on the slide. We'll also put it in the chat. That's available in both English and Spanish. So we hope you'll use that resource to build your advocacy toolkit. Okay, now we're going to go into a little bit of a different format. We're going to have a panel of some people we work closely with that are also elected officials, plus a wonderful staffer that we work with a lot. You heard from Monica Johnson-Hostler earlier today, who's the president and CEO of the National Alliance to End Sexual Violence and also the executive director of the North Carolina Coalition Against Sexual Assault. She's also a state representative in the House of Representatives of the North Carolina General Assembly. So we're really glad to have Monica on our panel. And then we have Amanda Grady Sexton, who is the Director of Public Affairs at the New Hampshire Coalition Against Domestic Violence and Sexual Violence, and also an at-large city councilor in the city of Concord, New Hampshire. And also we have David Gans, who's a senior legislative assistant for Congresswoman Ann Wagner from the 2nd District of Missouri. And Representative Wagner, and with a tremendous amount of support and advocacy skill from David, have been absolutely instrumental in moving forward the Crime Victims Fund Stabilization Act. So I know we're going to spotlight our panelists now and get into a conversation about some of these things we've talked about, so you can hear directly from elected officials and a staffer about what do they think? What do they think makes a good meeting? What are the things they think are important for you to do when you're meeting with your policymakers? So just waiting there we go. We're all here now. Okay, so the first couple of questions are round robins. I'll give you each a chance to answer. And I was asking if you could each think of a particularly good meeting that you had with a constituent, and what were a few elements of that meeting that stood out to you? And Amanda, I see you're unmuted. Would you be willing to go first?
Sure, I would. Thank you so much, Terry. That's a great question. I think that any time that I meet with a constituent or with an organization, and the intent of the meeting is to build a relationship, it tends to be memorable. For instance, the first one that pops in my mind is a recent meeting with a new executive director of a homeless shelter who reached out and brought with them a former client who was so excited to talk about the incredible work that the staff had done and how they had impacted their life and how they are now currently housed and really just the impact that the organization had on them. I think that anytime that you are hearing from somebody who is working to build that relationship without a specific ask, it tends to be a more memorable and sort of special experience. And I think the elements that stood out for me were that always the power of a story, meeting with somebody who has been directly impacted by the organization that the municipality might fund or partner with. Anyone who does their research and brings you credible information that you can later cite or provide. Um, I think it's always helpful when somebody just simply thanks you for your service or is interested in the work that you do broadly and has done their research in that area as well. And follow-ups. Anytime somebody sends a kind email or bonus points for anything in writing, a thank you card, those are always memorable. But again, these are investments in an overall relationship.
Absolutely. Monica, do you want to weigh in on that one?
Sure. I certainly echo everything Amanda has said. And similarly, I had a group of students and their teacher come visit me. And in addition to some of them had political aspirations, but they really were there to make an ask of me for a budget concession for our state legislature. And what stands out for me is they were well prepared. They were the recipients of the legislative ask. And so it wasn't parents or PTA or teachers or administrators. They were actually students sharing their real life impact. And particularly for this one is our state currently pays for all exams and college credits for our students. And so we had students across the spectrum. They were super diverse. And I think that to me spoke volumes to what their ask was, is no one brought me one person who has a sad story. Some of them had sad stories, but they also had extremely happy stories. They were sharing their college admissions with me. And so it became very personal. So while they had to ask, which I knew going in, they were very clear when they made their appointment with my office. But what really stood out for me is most of them, even if they were nervous, um, we took the time, I made the moment light, and they were willing to really just speak from their hearts and from their personal experiences. And I think there's nothing more important than hearing people's personal perspective for what government does or doesn't do for them. And so that always stands out to me. I love a leave behind. I'd love the information to be written so I can go back to it. And even more so, I would say it is the follow up, because the follow up is how you develop the relationship. And so for me, as someone who sits on both sides of that table, someone who advocates to federal members of Congress, but someone who's being, advocated to as a legislator, it's a reminder to me that it's not a one-off for those students. And one of those students is now an intern in our state legislature because they asked for it. They made a direct ask post their meeting, and they stopped by my office when I'm there to say hello and thank you. And so, again, at 17, they understood the value of building a relationship. And I think that's a lesson I'm sharing, because often as adults, we know that elected officials are busy. And so we're kind of just moving through the motions. And these young people did that, but they also understood how to develop a relationship. And so that will be forever memorable, is that
Hmm.
the young person built a relationship. We took a photo when I saw them doing their first, like, on the floor work. And so again, that will stick with me for a long time, because I definitely could not have done that at 17.
Well, that's really great. The value of preparation, but also I'm hearing you both talk about relationship building as being really critical. David, do you have anything to add to that?
Yeah, I mean, certainly echo everything that's been said before me. In addition to preparation, I think you know it was talked about before, but good solid data on what is the issue here and the background of what's going on. So at the federal level, a lot of folks sometimes come in and they have a lot of national statistics. National statistics are great, but what really gets staff to sort of perk their ears up, and especially when they bring it to their boss later on, is if you have data that is local to their district. Members of Congress always want to be pointing back to something that is specifically in their district. And if that data is not available, statewide data is helpful too. But I'd say when meeting with congressional offices, trying to get as specific as possible to what is going on in that specific area is so key to sort of grab the attention of the staffer. And I keep saying staffer because the vast majority of meetings are taken by staff. And if you are passed off to a staffer when you reach out, do not think that is a bad thing. Staff do a lot of the legwork on Capitol Hill. And I don't just say that because I'm a staffer tooting my own horn. It's just that's how things work up here is staffers are doing all of the work behind the scenes that a lot of people don't realize goes into crafting a bill or pushing a line item in a budget. That is all done between staff. And you can be very, very successful in pushing your initiative or pushing your proposal, and you might never even meet the member of Congress or the senator. Your only point of contact might be that one staffer. So really grabbing their attention with the district, the granular data of this is how many people we helped in your district this past year or this past month. This is how much money we stand to lose if this doesn't happen in your district. And if you could do this, it would benefit this many people in your district because that's what a member of Congress is going to want to tout when they go on radio or TV or anything back home is they're going to say, I brought this back home and I helped X people in St. Louis County. So that's what's really important, especially at the congressional level.
Yeah, you make such a good point, David, and that's really been proven out to me the real importance of building those staff relationships. I'm curious, how do you report back from meetings? Like, what's your approach to reporting back to Representative Wagner about like when you meet with people and stuff? How do you do that?
I mean, it's as was sort of mentioned before, members of Congress are very busy. They're running from events to votes to committees to all that. So the more concise that you're able to relay information or a proposal or an issue, the better, because, um, you know, we don't get a lot of time to sort of completely run through an issue that might take an hour to fully digest. It's a lot of providing quick context. Here's what's going on. Here is the issue. Here's the proposal that is either in the House or in the Senate or going through appropriations. Here's how we can be helpful, and maybe presenting different options. Here's what that benefit would look like. So always being able to really hammer home specific, concise points that the staffer can then relay to the member of Congress because if it's face to face, there's four other staffers in that office that also have something that they need to get in front of the boss. So there's a lot of information getting thrown at them, and the simpler, the better. And the simpler and more specific to this is how we're going to help the district can really go a long way.
Absolutely. Yeah, that's so important. Monica, turning to you, you mentioned at the beginning the importance of the young people's group that had a very specific ask. And we know sometimes people are having an educational meeting, they're not going to come in with an ask, but often we do have something we want a policymaker to do. Can you reflect for us a little bit about the importance of if you plan to make an ask, how you go about it, making sure you do it, that sort of thing?
Yeah. And I've shared this before. I believe that you should always make an ask, even if the ask is, here is our next open house. It's April. We have a sexual assault awareness month. So ask doesn't always mean it is a legislative ask, because essentially, especially at the state level, our communication is in between local, having been elected locally, it's in between local and Congress. So when we're in session, there are meetings nonstop. There's very little time. And sometimes those meetings actually happen on the way of walking me to chambers. And
Mhm.
so, again, it's important to make actually exactly what David just said that they do to the member. I think sometimes it's important that if you take stock of how much time does the elected official actually have, which generally the person scheduling the meeting will say she's got 15 minutes, she's got 10 minutes, she's walking, or she has 30 minutes, but making sure that you're aware of the time, because oftentimes we are on a tight timeline. And so if you have 30 minutes, then you have the opportunity to do what the students did, talk through your issues, give high level specific data to what your actual policy ask is, or give specific data to what services you provide. So for our rape crisis centers, provide the data specifically of what's happening in your local community. If you have 15 minutes, you have to introduce your organization, introduce yourself, and get to the ask. Because ultimately, the ask is on the 15-minute walk, 10-minute walk, isn't the ask that the member is going to remember, right? It's the ask that they've heard it. So when the staffer comes back and says, are you going to introduce this piece of legislation or will you support it? I will have heard what that ask is. And so I do think that it's important to read the member or the person you're meeting with and the time frame to ensure that you're building in enough information about your organization that the ask and the organization will be attached when it's time to actually draft legislation or support legislation.
Great. Thank you so much. And Amanda, I know we're off, NASB is often pushing people to be in touch with their members of Congress, and Monique is in her state assembly. But can you talk a little bit about the importance of local programs and advocates building those relationships with local government and why that can be really important?
Yeah, I'm happy to, Terry. Most of us local programs, coalitions are primarily publicly funded, and there's a lot of uncertainty right now around that funding. And so I think it's critically important that we have relationships both on the federal level, on the state level, but the municipal level is very important, especially to local programs, because your local city council or select board is going to control things that affect the everyday lives of survivors and your program. For instance, if you're looking to get support or funding for an ACERT team or a comfort dog, or you'd like to advocate for a new police social worker, or to apply for a community development block grant on behalf of, to build a new shelter or to repair your office, all of those relationships with staff within the city as well as the counselor are going to be critically important. And you want to have that relationship before you are showing up at a budget session, or if there's an emergency that you need to ask assistance of your municipality for. You want them to be able to know who you are, to trust what you do, and to want to partner with you. So I always recommend that our programs begin to foster that relationship with their local municipal officials, including school board members, by immediately after an election, sending a packet that has your information, your brochure, your catchment area, who you are, what you can provide to that particular elected official. Can you assist them if they get calls from somebody who needs information about housing, or how you can make a referral to a local program, or to have the crisis line on hand. And it's very important and very impactful to host legislative breakfasts or tours. Make sure that you invite everyone, especially if you're working with people who are candidates at the time. Everyone who is running is invited. Um, I love the idea of the Adopt the Counselor program, which is something programs can do with volunteers or board members or staff, and it can be something as little as on a quarterly basis, one person has a designated counselor that they provide updates to. That might be your yearly stats. It might be if you're featured in a newspaper article, it might be an invite to take back the night, whatever it may be, but it's the consistent communication from one person that is developing that relationship. I find those to be very effective. And also, I think it's important to remember that this is a mutually beneficial relationship. People who are running for municipal office need to report back to their constituents and show how they are creating a safer community and a safer city. And it is golden to be able to show that you are working with programs like sexual assault prevention programs and to be able to show the incredible work that you're doing. And so don't be hesitant to reach out or to ask to be on the council agenda to do a presentation and an educational forum. These people want to be able to show that they're working with you. You're wonderful stewards, and just never hesitate to work and foster those relationships.
Yeah, those are some really great concrete ideas, Amanda. The welcome packet can be so powerful, and I never heard about the adopt a counselor idea, and I love that as well too. And that relationship building, and just the idea that the relationship is reciprocal. You have the advocate really has something to offer too, and so well, you might need something from the policymaker. Know that they need the relationship with you too. Okay, well, there are a number of questions which we aren't going to get to, mine and other people's. This is we could do this. I could do this all afternoon. You guys are such a wealth of information. As we round out here, are there any particular nuggets of information you want to make sure to leave folks with for today? Just a couple questions people had. I can, I mean, I might be able to answer them for them. One person asked, like, they'd been offered a 15-minute meeting. That's not particularly unusual, right? When you all are trying to, sometimes you could think of it as actually a gift, like they're trying to find that minute for you. I
I
know when
completely
you're meeting
agree, and I
with
saw
staffers in
David.
Congress, sometimes you're standing in the hallway.
That's right. I saw David give a thumbs up. I can't agree more that that 15 minutes really is reflective of I see the organization and the need and the importance. And so I'm going to try to make the time to meet with them. It is, and again, hallway, walking to chambers, all of those things are very real when you're trying to squeeze in all of the organizations that are important to our community. I think one of and Amanda gave great examples of ways to build relationships. And I think the one thing that I would add, especially for all of our advocates who are, and I think the question I saw was about your state legislator. I think the same thing is true. If you have so again, our local rate crisis center that represents the county that I live in, well, I don't represent all 12 municipalities in my county. So our rape crisis center, I have two people who are actually in my district. So one works at the agency and one is a survivor. And it's funny because I'm going to send them a text and be like, am I your adopted legislator? Because their job is to follow up with me. If I have a town hall or if I'm doing a coffee chat, they always attend. If I send a newsletter, that constituent responds. And of course, I know them through my job as the coalition director, but it's been fascinating to watch that it's not just me, it's other elected officials that represent our county that they are each developing the relationship with based on they live in the district, which is important, especially at the state level, we have staff, but we don't have as many staff as Congress. And so thousands of emails are hard to sift through and making sure I get them all, but it's very personal when they are absolutely a constituent of my district. So something to think about with your volunteers, your board, and your agency of choosing the representative that is in your district.
Okay, well, thank you each and all so much, Monica, Amanda, and David, for first of all, the work that you do every day. As I mentioned with David, getting the Crime Victims Fund Stabilization Act over the finish line in the House, and now we're on to the Senate, and Monica and Amanda, all the work that you do on behalf and for survivors and your city and your state, respectively. There have been a couple questions we haven't been able to get to. The value of leave behinds, you all had mentioned that. Somebody raised it can be really important, like if you run a culturally specific program, maybe look to caucuses where, like, so you maybe, there's a Black caucus or a Latino caucus where you can meet people that will care particularly about the issues that you're working on. And then somebody asked, and we don't have time for it, but if any of y'all want to try to answer in the chat, what do you do if a relationship has been damaged? So we can't do that live, but it's a really good question. Thank you all so much. And now we're going to jump into some nitty gritty of some very specific issues that we're working on at the federal level, give you a little bit of an overview of that. And so I'm going to turn it back to Ellen to get us started with that.
Thanks, Terry. So this is a portion of the webinar where we're going to talk about what Terry and I spend our time doing and when we are advocating on Capitol Hill on the federal policy side. I also, as a follow-up to what our panelists were just talking about, Terry and I had meetings in Washington, D.C. about 2 weeks ago, and we were meeting with a new staffer, and we were sort of nervous because we didn't know this person, but we were excited to meet someone new and share our information. And we were surprised. It was a busy time, but we had to do the meeting in the hall. And so we're like, okay. And it was great. And you always wonder, like, oh, can this staffer or elected official be really attentive when we're in the middle of a hallway and people are walking by? But he was so attentive, and Terry, wasn't it? It was one of our best meetings. So I just want to do a shout out for hallway meetings. Okay. But I'm going to start with some of our key federal issues that is funded all through Department of Justice programs. So I'm going to start, if we can go to the next slide, with the Victims of Crime Act. And I'm also going to talk about the Crime Victims Fund Stabilization Act. But first of all, let's start with VOCA. I think probably many of you know that VOCA is a fund that is funded not through taxpayer dollars, but through fines and penalties from convicted federal offenders and also from deferred prosecution and non-prosecution agreements. So all this money of fines and penalties come into a fund, and that goes out by formula to all the states. And then each state distributes the funds. In fiscal year 25 and fiscal year 26, $1.9 billion was released to all the states. There's also a set aside for tribal crime victim services and also victim comp. Actually, last year, $1.95 billion was released. The president's budget that just came out almost a week ago proposes 1.9 billion again, and we are advocating for steady funding at $2 billion. We rounded up a little bit because this is some of the most flexible funding that programs receive. You can use it for staff. You can use to pay staff for crisis intervention, counseling, court accompaniment. And it is we talk about it as our key backbone funding for services for survivors. The challenge with the Crime Victims Fund is that it is dependent on these fines and penalties and deferred prosecution agreements. So the money coming into the fund has been declining over the last few years because of the long time it takes to get these federal criminal cases across the finish line. Also, in the last few years, through various administrations, not as many cases are being brought. And so this all impacts how much money goes into this fund. And that is why it's not a constant number. Next slide, please. So, to help with stabilizing the Crime Victims Fund, we last year in the last Congress, and then again in this year, a bill called the Crime Victims Fund Stabilization Act was introduced in a bipartisan manner in the House. Congresswoman Ann Wagner, with David taking the lead on this as the key staffer, was the primary Republican co-sponsor with Congressman Moran from Texas, and then Democrats Dingell and Costa, and Congresswoman Bice and Congressman Schmidt, also Republicans, all in the House joined together and to get this bill passed in a hugely bipartisan way on January 12th. In the Senate, this bill has been introduced by Senator Murkowski, Republican from Alaska, and Senator Durbin, Democrat from Illinois. And what this bill does, it directs for 5 years only, not forever, but in an attempt to stabilize the Crime Victims Fund, to take money from the False Claims Act. This money is unused. It just goes back to the general U.S. Treasury, and the legislation would take that money to put it in the Crime Victims Fund. The False Claims Act is used when bad actors get federal grants and then defraud the government. They don't use it as they said they were going to use it, and that's across any federal agency. So when a False Claims Act is filed, they're saying, the grantee has done wrong. They haven't used the money, so they have to pay the money back to the federal government. That money goes back to whatever federal agency they got the grant from. But there's also penalties on top of that, and that part of the money goes back to the U.S. Treasury. So this bill would take that unused funds that goes back to the U.S. Treasury and put it into the Crime Victims Fund without relying on taxpayer dollars, without adding a new funding stream. So now we are working diligently to get the Senate to take the House passed bill and pass it in the Senate. It was, I'm going to repeat again because you don't often hear this these days, unbelievably, overwhelmingly bipartisanly passed in the House. And so we are really just need to get it across the line in the Senate. And then I also want to talk about a primary priority program for us as serving sexual assault survivors is the Sexual Assault Services Program. In fiscal year 26, which we are in now, it is funded at $79.5 million. That goes out to all states. And also it goes to states, it goes to state sexual assault coalitions, tribal coalitions, and territorial coalitions by formula. The president's budget that came out last week proposes a cut of $1 million to $78 million. But we, as advocates, and because we know the need is so great, going back to the top of the webinar, what our survey says about the increased need of those needed services, we are advocating for $100 million for the Sexual Assault Services Program in fiscal year 27. This money funds critical services, including resources tailored for culturally specific needs, crisis intervention, transportation, cash assistance, and it is just critical funding that every state gets, and that's why we need an increase in funding. Next slide, please. The other thing we want to update you on some administration actions coming out of the Department of Justice that we're watching closely. In the president's fiscal year 27 budget proposal, he did propose cutting funding from the Office of Violence Against Women. In addition to that $1.5 million cut from the Sexual Assault Services Program, the budget proposes to completely eliminate funding for programs like grant programs like restorative justice, culturally specific grant program, underserved, direct cash assistance, and grants for LGBTQ survivors. This was the same proposal in last year's budget, but we fought hard against that. And at the end of the day, Congress did fund these programs, but we're going to have to fight once again to make sure they're funded this year. Also, there's a proposal in the budget to consolidate 3 independent, critically important offices into one. One of those being the Office of Violence Against Women, the COPS office, and the Office of Justice Programs is being proposed to be consolidated to make a new office called the Bureau of Justice Grants. We're not really sure how that would work or why there is a need to consolidate. In the Violence Against Women Act of 2022, the statutory language specifically states that the Office of Violence Against Women needs to be a separate and distinct and independent office within the Department of Justice. Also, the budget proposal eliminates 14 positions at the Office of Violence Against Women, which is obviously something we don't want to see. Other administrative concerns we have, probably as many of you know, you might be waiting still on fiscal year 2020 to hear about your fiscal year 2025 discretionary grant awards that you might have applied for, and we're already well into we're 7 months into fiscal year 26, and many people have not heard about their fiscal year 25 grant applications. We are working hard to push on getting those out the door and announced. We know that programs are really struggling, not knowing if they're going to get these grants or not. It is a tenuous time. And also, we, of course, then are waiting for notice of funding opportunities for fiscal year 26. It's getting a little late already. And if these NOFOs don't get out the door, then people can't apply, and that's going to mean more delays in funding. So these are the big areas that we are watching and working on and advocating related to administration actions.
Okay. Thank you so much, Ellen. Great job giving us an overview of our priorities in the Department of Justice. And I'm going to talk just a little bit about our priorities at HHS. So, the Rape Prevention and Education Program, such an important formula grant that's at CDC. So it's different than other Violence Against Women Act programs, but it is authorized in the Violence Against Women Act. And this is a primary prevention program. The formula grant goes out to every state and territory, plus coalitions, to fund primary prevention of sexual violence. It funds cutting edge prevention programs and uses evidence-based strategies to strengthen leadership. And we love this program. It's so important to us. It's been funded in a steady way by Congress the past couple of years at $61.75 million. It's authorized at $100 million, and we really want that full authorization. I'll talk to you more in a future slide about some other things that are going on at CDC with the RPE program. But for now, let's go to the next slide. We also think it's so critical to invest and expand in the public health response to survivors of sexual assault, to adult survivors of childhood sexual abuse. So we're requesting $100 million at the Office of Family Violence Prevention and Services to help build partnerships between local sexual assault programs and behavioral health care. We know survivors need more access to mental health and substance use care, more access to primary care. We know that the short and long-term effects of sexual assault can undermine a person's physical and mental health. And so that's why we're really looking for more money, more investment at HHS through the Office of Family Violence Prevention and Services. And we have this $100 million request. Just as we have an appropriations request, we also have, yes, you were right to move on to the next slide. Thank you. We also have legislation called the Healing Partnerships for Survivors Act, HIPSA, which creates a pilot program and authorizes $30 million for it to help fund and build these partnerships between local sexual assault programs and community-based behavioral health, health care, and those sorts of things. We know we've done a lot to really invest in partnerships between sexual assault programs and criminal justice organizations, but we really think more needs to be done to respond to the full health and welfare needs of sexual assault survivors. So these two, the legislation and the appropriations requests, really move us in that direction. Okay, next slide. So what we're watching at HHS in the president's budget proposal, unfortunately, we saw a really intense cut to the rape prevention and education program. We saw this last year as well, where the budget eliminates the injury center where the rape prevention and education program is, and creates a new administration for a healthy America where RPE and the Delta program, which is a domestic violence prevention program, would live. It combines those two programs together, but then cuts them about in half. So that's something we're pushing back against. This was similar to the president's budget proposal in FY26, and collectively we were absolutely able to make the case with the majority and minority parties on both the House and Senate about the importance of fully funding Delta and RPE, and so we hope to do that again in FY27. We've also seen a lot of position reductions at CDC, which is impacting the administration of the program. And we were also sad to see last year the elimination of sexual assault technical assistance at the Office of Family Violence Prevention and Services. And that's why it's so important that we keep moving ahead with the requests to fund sexual assault services and partnerships at the Office of Family Violence Prevention and Services. So I'm sorry I'm going a little fast. We're coming to the end of our issues, but I'm going to turn it back to Ellen to talk about HUD, and then I have just a couple more slides for you.
Yes, thanks, Terry. And so to quickly go through our HUD request. Also going back to, the original survey results, we know it's overwhelming the need of survivors, their needs related to housing. And so we are doing a concerted effort this year to on these three specific asks at the HUD, the Housing Department of Housing and Urban Development. We are asking for $75 million for the DVSA bonus funds, which are part of the Continuum of Care funding grant. Those grants go to homeless, to help homeless individuals. And obviously we know that the vast majority of homeless individuals are survivors of sexual assault or domestic violence. And so these are specific set aside funds. It's currently funded at 52 million. We're asking for 75 million. Also, we are asking for an $100,000 increase for the Office of Gender-Based Violence at HUD. This is a new office that was created as part of the Violence Against Women Act of 2022. And that office, small but mighty, works to make sure that all the HUD housing programs know about the protections found in the Violence Against Women Act related to domestic violence and sexual assault survivors. And so that office needs funding to operate and pay its staff. And then we're asking specifically for $15 million for domestic violence, sexual assault training and technical assistance to assist HUD grantees, once again, successfully implement housing protections that were put into VAWA 2022. Terry, back to you.
Great. Thank you so much, Ellen. We also feel like it's so important to call on Congress to support the needs of immigrant survivors of sexual assault. One of the important things we're asking for you this year is to ensure that no funds are used to apprehend, detain, or remove benefit requesters or beneficiaries of survivor-based relief, like the VAWA self-petitioner classification, people that might have or be asking for a T visa that relates to having experiences being trafficked, or a U visa. and or special immigrant status. So we want to make sure that people are protected from removal when they are victims of crime. We also want to make sure that unused, unallocated U visas are recaptured. We know that so many people need access to U visas. That's when somebody experiences a crime and needs to have status in order to cooperate with law enforcement moving forward with that crime. We know that there are years when the U visas weren't allocated, and so we'd like to really see some more U visas be available. And then we were really asking for more data on situations when someone may be asking for asylum based on gender-based violence. We don't have much data on what that looks like. And so we're also requesting that more data be gathered on those issues. So those are some of the things that we're prioritizing for immigrant survivors. And then we're also supporting legislation called Virginia's Law that's named after Virginia Giuffre, who was abused by Jeffrey Epstein. And this bill was just introduced recently, and it's designed to eliminate the statute of limitations for adult survivors of sexual abuse and trafficking so that they can bring civil claims against abusers. And it's supported by a lot of survivors and advocates, and it's something that NAESV is endorsing as well. Okay, and so you can see here a summary of all the issues we touched on in terms of our congressional requests. And we also are going to drop in the chat a sign-on letter from the National Task Force to End Sexual and Domestic Violence that supports many of these appropriations requests. There's still a couple of days to sign your organization onto that letter if you're interested. And I know lots and lots of information has been dropped in the chat for you on these issues. And we're always available too. So I think that concludes our section on the issues. I'm going to, oh yes, just some contact information. If you want to jump right in and get in touch with your members of Congress as a result of this meeting, know that you can go to senate.gov or house.gov and look them up, find their information. There's a central switchboard number. There's lots of ways to find your rep or your senator and weigh in with them. And I'm going to turn it back to Maureen as we start to wrap things up.
Thanks, Terry. I do want to flag there was we've been responding to the questions in the chat, which has been great because we're kind of running out of time to answer a lot of questions. There's a remaining question. I don't know if anyone has anything to contribute to that. Who is working on building prevention programs and strategies that simultaneously reduce or remove funding dependence on systems that are inherently built to benefit from the harms created by these systems? I mean, I think this is kind of a big question. I'm not sure we have a direct answer for this, but I didn't know if any of our presenters wanted to comment. And I see Terry typing in there as well.
Yeah, I will try to have an answer for that in the Q&A. I mean, it's a big question, so we might have to, we may not be able to fully answer it here, but it's an important question.
Yeah, thank you. Um, okay, and I'm not seeing other questions. So we would actually like to have one other moment with you to give you the opportunity to reflect on everything you've heard for the last 90 minutes and thinking about what one advocacy related action you could commit to during this month or next month or in the near future. And we're going to give you the opportunity to respond to this Slido question. If you want to scan that QR code with your phone, I'll also drop the link in the chat. We would love to hear anything that you want to share with us. It'll pop up anonymously. Whether it's I'm going to find out who my city councilor is, or I'm going to make an appointment to meet my, state representative. We would love for folks to just take a minute and share some things that you've been inspired to consider doing. I see some folks are typing. That's exciting. I know that this webinar for me too is always reminding me about, we work a lot on the national level and, reminding me about my city council and my state representative. Someone here is going to reach out to a sexual assault advocate. That's awesome. Finding out who your local program is if you don't. Adopt a counselor. Awesome. That's great. Getting the mayors for a new county involved in our coalition against domestic and sexual violence. Awesome. Look at my commit to learning more and continuing to educate myself on these topics. And hopefully the resources we provided you on our website and our toolkits will help you. You can always reach out to us. Participate in Denim Day. That's coming up at the end of this month. Connect with your local rape crisis centers and find out if there's any activities that folks are doing that you can be part of. Schedule another meeting with senators. Make a specific issues document for the Federal Advocacy Day meetings. Reach out to city council members about SAM. Build awareness. Research what bills directly impact my organization. Yes, and if you are not familiar with your state or territory coalition, they're doing a lot of state level policy work. Reach out to them and find out how you can help and how you can participate. Share the survey report in our newsletter. Awesome. That's great. And please reach out to me if you have any questions about any of these materials. I'm putting my um, incorrect email. I'm writing now doing my correct email in the chat. And I'm just thrilled with all of the participation happening here.
And there was a
Support.
great answer in the chat to Maureen. Someone said, I'm a director of student life in a high school, and I teach kids on speaking up when going to college and in high school and teach them consent. That's another great one.
That's awesome. There's so many things you can do on so many levels in the individual classroom with peers, with friends, organizations, in addition to your policymakers. Well, thank you all so much for your very robust participation. We're going to leave you with this last slide that gives you, again, my contact information and Terry's. If you have any questions, um, please, you can find the toolkit, infographic, and fact sheets at our website, at our advocacy page. The link is there, and I dropped it in earlier. And then you can see below there, please join us and follow us on all of our social media. And if you go to our website, we encourage you to sign up for our newsletter as well, which is, where we share information with the broader public about the work that we're doing and things that are coming up that you can participate in. And with that note, I just would like to thank you once again, and I hope you all have a pleasant evening. And thank you for doing this work and caring about this work and for being with us today.